The city councillor for Somerset Ward says she is frustrated after an addictions clinic in Chinatown didn't close after the old owner said it would. The clinic is located on Summer Street West near Rochester. It was previously called Northwood Recovery and was expected to close by Monday. However, the location remains open and appears to be under new management by a company called New Dawn Medical, which operates several other clinics in the province. CTV Morning Live has reached out to New Dawn Medical for comments, but has not heard back. And Ariel Trosser joins me this morning to talk more about this conversation. Okay, first of all, just give us your thoughts on this whole ordeal, because obviously you thought it was going to close Monday, and that isn't the case.
So the real genesis of this perfect storm in Chinatown started actually when the provincial government forced the Somerset West Community Health Centre to close both its supervised consumption site and its safe supply program. Both of those programs were being run to help people with serious addictions, and it was done in a way that was really accountable to the community. And the supervised consumption site meant that people, if they came in to take a particular medication, they could take that dose in a semi-private environment. The Ford government forced them to end that program and also to end all harm reduction programming. And within a couple weeks, this clinic called Northwood Recovery, which had previously caused a lot of challenges in Hindenburg, moved into Chinatown, so it created a bit of a perfect storm. The issue was that it was part of a network of 15 clinics that was run by a doctor based in Sudbury, not even based in Ottawa, who was doing entirely virtual appointments with only a receptionist and a nurse on staff, and they were both prescribing and dispensing a medication called Dilaudid, which is a really powerful opioid. And the spin-off effect of that is we were seeing a huge uptick in a criminal ecosystem, including drug dealing and robberies near the clinic. So after many weeks of trying to work to mitigate these challenges and receiving very little response from the clinic, I received an email and a call over the last couple of weeks saying that they intended to close and that June 9th was the day that they were going to close. Sure enough, on Monday, the residents walked by the clinic to see it's business as usual with exactly the same staff and supposedly under new ownership. So there's a high level of frustration.
So how does this happen? Where are the legalities involved with the municipality in this city? Because it seems like it's a provincial issue, but how does the city not have any kind of say in what opens within our limits?
Because healthcare is entirely provincially regulated. So I actually have no tool in this regard. And there's no guardrails around a clinic of this nature. Safe supply is a really important health intervention for people with serious addictions. The intention is to ensure that they're not taking poison street drugs, and we know right now that the drug supply is incredibly poisonous. But where it's done successfully, there's some community housing buildings where it's done within the building and people are able to take their medication on site, and it's avoiding that diversion problem. But this private clinic model that seems to be proliferating, and I think it's quite indicative that a lot of these addiction clinics have multiple locations and often one or two doctors servicing all of those locations. It's really become the Wild West, and we're not seeing any provincial guardrails placed on clinics of this nature, and this medication can be highly dangerous if it gets into the wrong hands.
Have you tried to have conversations with New Dawn Medical?
So the doctor did reach out late yesterday. So, I had no knowledge about who they were and how they were planning to operate. So I'm really hoping we can work together to ensure community safety. I just do think that there are some real problems with the fact that there's no provincial regulation in the municipality. They have no duty to inform us when a clinic of this nature is coming into the community. And there's no regulation saying that they need to provide the level of wraparound support that an organization like the Somerset West Community Health Centre was providing.
So really quickly, what would you like to see change, or what do you think needs to happen so this doesn't keep on continuing in other neighborhoods?
Well, one suggestion that has been made by the addiction treatment community is that the medication that's being prescribed, Dilaudid, frankly, it's not strong enough for people who are addicted to fentanyl. There has been some movement, and there is a drug that is injectable and that could be done once a day on site, reducing the reality of people walking away with large quantities of drugs on their person. If that could be added to the Ontario formulary, the addiction medicine community seems to think this would completely eliminate the diversion problem. I think we need regulatory change at the provincial level. We want to ensure that people get the care they need, but this spillover effect, this entire ecosystem, this entire chaos that it's created in the neighborhood, my understanding is that it's happening time and time again with this private addiction clinic model. It's a backdoor privatization of healthcare. When this was being done responsibly through the community health center, I did not have complaints of this nature. It's really created a crisis in Chinatown, and it's one that we need need to deal with.
Thank you so much for taking some time to, chat with us today. We truly appreciate it.
Of course, thank you.
You're welcome.